Hi, I'm going to talk about career options in health informatics. So this is how I am planning to speak. First, I'll introduce what is health informatics. Then I'll be talking about the opportunities of health informatics and health informatics professionals globally as well as in India. What are the initiatives taken by the government of India in the area of health informatics? Then what are the recent trends of health informatics applications in various levels of healthcare system? Who are the major stakeholders and key players in designing and developing healthcare informatics applications? What are the roles of health information management professionals in the existing healthcare scenario? What is the Indian scenario? And some activities of HL7 India. I believe all of you are familiar with this DIKW pyramid. Whatever you observe and collect is the data. When you put that into context, that means do data processing, you get information. And when you process that information, that is informatics, that means add meaning to it, you get knowledge. And when you have insight and intuition over and above knowledge, then you can gain wisdom. So this is a continuing spectrum from data to information to knowledge to wisdom. What is informatics? If I put it simply, health informatics is nothing but the art and science of processing health information. If we go for a formal definition, and there are quite a few formal definitions for that, but mostly it deals with the storage, retrieval, and optimal use of biomedical data, information, and knowledge for problem solving and decision making. If you look at this figure from Shortlift, you can see it can act in the cellular and subcellular level, that is bioinformatics, or at the tissue and organ level, then we would be calling it imaging informatics. If it's at the individual patient or subject level, then it is clinical informatics. And if it is dealing with populations and society, then we can call it public health informatics. So this is a very wide spectrum. You can look at the umbrella, and it's a continuing spectrum. If you look at another way, Bill Hirsch, you can see in this picture the different relations between these different types of informatics. But please note here, the most important thing is people. It's not information and technology which makes informatics, but it's the people like you who would be making informatics happen. The International Medical Informatics Association, they had proposed a curriculum for biomedical and health informatics in 2010. And here, if you have a look at this, the library and information sciences, biomedical engineering, cognitive sciences, chemical sciences, linguistics, mathematics, nanosciences, material sciences, mechanical sciences, so many things all can come together. If you look at this clinical sciences, public health, and if you look at this portion D, that is where bioinformatics and biomedical health informatics they're coming together, that is also known as translational bioinformatics or translational medicine. What is that? You can see what data you get from the bench or the wet lab, that is in the test tube or in vitro, and what data you get from the bedside or the clinics, the patients, that is in vivo. How do you make them talk to each other? You may require computational modeling or statistical modeling. This is the in silico processing. So this is what translational bioinformatics or translational medicine is dealing with. And this is not an easy job. There could be barriers at the innovation level, barriers at the validation level, or barriers at the adoption level. So unless you overcome these barriers, or you can't talk in each other's language, that means you can be interpreters. That's what the informaticians can be doing. Now, what are the modes of information if you think of healthcare delivery? It could be audio, sounds. It could be images, either still images or video images. It could be text, but most commonly it is a combination of all these. Sometimes you can also have some higher level of information for mechanical intervention, haptics, robotic telesurgery, but these are the general modes of information. Now, what are the career prospects in health informatics, or where do you get the jobs? If you have training in health informatics, you can be employed in the hospitals or with the other healthcare providers. You could be employed in pharmaceutical companies. You could be getting a job with the health IT vendors or health IT consultants. You could get a job in public health organizations, with the government or the non-governmental organizations, with the health insurance companies, or even in the academia, including the libraries. So what do you need to get a job there? In other words, what would be the skill requirements? Enrico Coira, he says that first of all, you need to have a very good understanding of the healthcare industry. And most certainly, you need to have good communication skills. That's what I was saying earlier. You have to be good interpreters. You should be able to speak in the language of the diverse discipline people who are coming. This is a field for multidisciplinary interaction. You should be able to strategically and logically plan, manage, lead, and supervise. Of course, you must have a very good idea about information technology, information analysis, and organization. You may also have healthcare professional training. You may have knowledge of system infrastructure design and networking. You may have programming skills. If you look at these, not all people can have all these skills. So it will really depend on your background, what you had studied before becoming a health informatician. That will take you to your ideal job. You'll be building upon your prior knowledge. But the first few ones, understanding of the healthcare industry, communication skills, logical planning, these things everyone would be requiring. So what are the different types of jobs available if you have a training in health informatics or biomedical informatics? You may become an academician, a researcher. You could be a clinical data manager. You could be a chief medical information officer or chief information officer. You could be clinical information manager. You could be a consultant. You could be a healthcare webmaster. You could be information manager, information security manager or risk manager, revenue manager, privacy manager. You could also be a medical director for informatics. You could be medical director for information systems. You could be a pharmacy systems analyst. Again, your background will really determine which area you are most likely to do well in. This is one of the various websites. If you want to look what are the healthcare IT jobs, what are the hot jobs right now, so you can go and visit sites like this and you'll get an idea. So if I want to summarize what sort of career prospects you may have, you could be organizing evidence used in evidence-based medicine. You'll be helping support patient care, reimbursement, teaching, research, quality improvement, and legal inquiries. Accomplished in the art and science of electronic information systems, you may be serving as advocates of the patient-provider relationship and the information suppliers for the business side of evidence-based medicine. This is just a snapshot. The world is yours. You can decide. And as I said, depending on your background, you can go on adding skills that will lead you to your dream job. Now, what is the government of India doing? If you look at this in the year 2005, the Ministry of Communication and Information Technology brought out an ITIH vision to define the information technology infrastructure for health, or ITIH, in India. They visualize that it will standardize the capture, storage, and exchange of health information in an environment supported by a robust legal framework and a mature health informatics education system that will bring administrative simplification and improve patient care services by providing a continuum of care. So this document preparation had started in 2002, and by 2005 this document was published. It's available in the website. And from this document, if you'll have a look here, education is definitely at the cornerstone. It's very important. Following this, we had the National Knowledge Commission that worked from October 2005 to October 2008, and one of its many recommendations was to form a health information network. Following this, the Ministry of Health and Family Welfare in September 2010, they formed an expert committee for the standardization of Electronic medical records, I've also been a member of that, and they've been working on how to impose these standards for healthcare information exchange that can be interoperable. Now, when we are talking about exchange of healthcare information, there are various challenges. Challenges could be across the healthcare institutions or others who need the data like insurance sector, public health sector, research. Now, what are the questions? How can clinical data be shared among different healthcare enterprises who are using different technology, different databases, different ways of coding the data? Then how can the same patient be identified across different institutions? Also, how can data exchange be secured and access to the patient data be monitored? Not only that, even within the same healthcare institution, how can the patient's clinical data from different sources, whether it be it the laboratory or the pharmacy or the clinical notes, how can they be brought together to the patient's point of care into an electronic medical record? These are not easy things. We don't have solutions for most of these, but a lot of work is going on all around the world. So one of the ways to make things happen interoperable is apply standards. Standards could be for vocabulary, it could be for content exchange, it could be for transport, it could be for privacy, security, confidentiality. Let's talk about the content exchange standards. There are various. I'll just talk about one, that is the HL7. You may have heard of DICOM also, that's the Digital Imaging and Communications in Medicine. Now, what is HL7? It's an ANSI accredited standards development organization. It's a not-for-profit organization. We have volunteers, providers, customers, vendors, government. So doctors, engineers all together are working. And it stands for, HL7 stands for Health Level 7. 7 represents the highest or application level of the ISO communications model for OSI, but this classification is not encouraged now. If you look at this classification here, at the 7th level, it was the application level. So historically, the HL7 name remains. And there are country affiliates, more than 40 of them, and you can see India is also one of the country affiliates. I'm the chair of HL7 India, and we offer e-learning courses not only on HL7, even from my institute I offer e-learning courses on health informatics. It's an introductory course, just a short one for 12 weeks. And not only that, we also use wikis. We have a page on the Facebook, and we use different Web 2.0 modalities. So this is the wiki page, and here you can get the courses and other things. Now, there's a super course maintained by the Pittsburgh University in US, and there also I've uploaded a couple of lectures. This was among the top 20 lectures to be downloaded globally, and this is a more recent one, the difference between a wiki and a learning management system, or how one can supplement the other. And there are lots more. A lot of activities are going on, and you can definitely join the bandwagon. Now, if you talk about future prospects, well, flexion is the alpha and omega of life. So at one point we were flexed, probably we are going back towards it, but the future is bright. And if any of you have any queries, feel free to email me. I'm always available through email, that's supten@gmail.com. Feel free to send an email to me, and I usually respond to any email the moment I see it. I hope you enjoyed the talk. So thank you, and wish you a very happy career. So thank you.